joining us today. I think, like many of you, I've been looking forward to this and learning from our expert panel with a sense of appreciation, but also urgency for the moment that we're in. One of the things that's so great about the National Collaborative for Infants and Toddlers is it brings together people across issue areas and geographies and policy interests. But there's one thing we have in common, and I think it's the understanding that if we really care about children's health and family stability and economic well-being and strong starts, we have to care about how we pay for them, and we all have to be smarter about how to do that. And we are so lucky today to have three, they call them subject matter experts, but they're more than that. They are also allies and friends and advocates and strategists and just three incredibly wonderful human beings who never say no. So it is my honor to introduce our panel today. I'm going to start with Amber Wallen. She uses she, her pronouns. She has spent her last 15 years doing and leading policy legislative campaigns and outreach work on tax and budget, economic justice, early childhood and education policy issues. Before joining State Revenue Alliance in 2023, Amber was the executive director of New Mexico Voices for Children, where she helped lead important wins for families through tax justice reform and a very well-known campaign now around constitutionally guaranteed funding for early childhood services and a transformational court case to increase K-12 education funding. Amber is a state and nationally recognized expert on tax justice and family well-being issues, whose passions in working alongside partners and communities to build greater equity and opportunity for families and kids across the country. The National Collaborative for Infants and Toddlers is very proud to have Amber as a member of its steering committee. Amber's joined by a colleague of hers, also from State Revenue Alliance, Jamie Cobb. She, her pronouns. She's an organizer, a strategist, a relentless advocate for justice, because when the system isn't built for everyone, you build a new one. Prior to joining the State Revenue Alliance, Jamie spent time as an electoral organizer, flipping districts in South Carolina and leading a reproductive justice organization in Texas. She believes in the power of organizing because she has seen it transform lives. And she believes that justice isn't about one issue, one policy, or one election. It's about changing the way power operates at every level. We also are joined by Bruno Showers from the Children's Funding Project. Bruno is the state policy manager for the Children's Funding Project. He'd also joined them in 2023. It must have been a big year for transitions, as a state policy manager to support the organization's capacity to analyze state-level revenue options to fund children's programs. Prior to joining the Children's Funding Project, Bruno spent 5 years as a senior policy analyst at Arkansas Advocates for Children and Families, where he led the organization's advocacy efforts related to state tax and budget policies, as well as programs that support family economic security. Bruno has over a decade of experience in the nonprofit and public sector, including time spent in the Arkansas Department of Health and Human Services, Arkansas Public Policy Panel, and the Center on Budget and Policy Priorities. So on behalf of the National Collaborative for Infants Toddlers, I'd love to thank Amber, Jamie, and Bruno for sharing their time and expertise with us today. And to get us started, Jamie's going to go or get us grounded with a primer on taxes and early care and education. Take it away, Jamie.
Awesome. And thank you so much, Lori, for that intro and NCIT for having us here. Again, my name is Jamie Cobb, and I'm a campaign manager at State Revenue Alliance. Andrea, next slide. Next slide. So SRA is a national organization that helps grassroots groups, legislators, and labor organizations across the country in over 35 states with ballot and legislative efforts to pass progressive tax policy that helps build and support communities. So as a campaign manager, I have the pleasure of working with partners across the nation on connecting state tax and revenue fights to early childhood education issues. I also work with reproductive justice and maternal justice organizations and do some general campaign supports throughout red states and southern states. Next slide. Campaigns in Maine, Massachusetts, and New Mexico, fights that SRA has been a part of, have taught us that, and our advocates, that if we want to win for kids, and we have to care about taxes, because at the end of the day, tax policy is people policy, it's family policy, and it's how we care for each other. Tax policies are a powerful tool to support children and improve childhood well-being, not just at birth, but through adulthood. Next slide. Most of us have stood in budget committee hearings asking for the same piece of pie for childcare funding, for maternal health resources, food resources. Meanwhile, just down the hall, tax committee is giving away billions of dollars each year in tax cuts, taking apart our pie piece by piece, pretty much leaving us with crumbs. Which means that the fight also needs to be in the tax committee meetings, demanding they stop cutting taxes for corporations and wealth and the wealthy, to stop chipping away at the revenue streams we have that allow us to have the resources we need in order to support strong, healthy kids and generations of them. As you can see from this pie chart, taxes make up over 50% of state revenues. So if you live in a state like I do, like Texas, where we don't have a personal income tax, that is a large chunk of revenue streams that could be supporting families, that could be supporting social services, that could be feeding kids, feeding seniors. It could be supporting so many things that our communities need. And taxes aren't the villain they're often made out to be in the media, in messaging and talking points. On the next slide, um, you can see here in a lot of words, but that taxes just have this unique and powerful place in policy and in society to improve community well-being, improve health and education outcomes, decrease poverty, and improve racial and gender equity. Because of the way our tax system is currently set up, most tax cuts have gone to the wealthiest residents over time. And it's not just about income, it's about wealth inequity because at the end of the day, wealth inequity is racial inequity. Because opportunities to build wealth, like income, like stocks and home ownerships, are built upon a history of policy decisions that have overwhelmingly benefited white men. Because 87% of US wealth is owned by white households. And when tax cuts favor investment income over wages, and white households already hold most of the wealth, it deepens the division, it fuels disenfranchisement, and it limits economic mobility for people of color and women. Because frankly, in order for tax cuts like capital gains or dividends or business equity tax cuts to help you as an individual, or to help your community, you have to have that wealth to begin with. And when you don't, because women and people of color, especially Black women and Latinas, are less likely to have access, we're also less likely to benefit from tax policies that come from the top down. Next slide. And most state taxes have a regressive tax system, meaning that wealthier people pay at a lower tax rate than low income people. And next slide. And when I say most, I really do mean most. 44 state tax systems are regressive. And a regressive tax system is one where lower income folks are paying a greater share of their income into the tax system. And on the other hand, a progressive tax system puts the pressure on higher income individuals and corporations to offset regressive tax. So 34 states tax the lowest 20% of earners at a higher rate than any other income group. And 41 states tax their 1% at a lower rate than any other income group. Only 6 states plus DC reserve their lowest tax rates for their lowest income residents. So maybe you live somewhere that's a blue state. And when you ask for policies to be passed, they're like, yeah, we're behind you. We're here for it. It's also very likely that you live in a regressive tax system. Um, and because of that, that is why SRA, that is why CFP are here to help and we're here to fight. Because the challenges that we see, not just as individuals, but as national partners, is that the programs that are most essential for positive childhood development are underfunded. So food programs, housing, affordable childcare. Next slide. And because they're underfunded, they're continue to be unstable and stuck in a cycle where we can't raise revenue year after year. Um, and as you can see, taxes have this power to improve opportunity, improve inequity, to decrease poverty and hunger. And the people who care about these issues don't often have access to the information that they need. They don't have access to how to advocate, how to talk about taxes in a way that doesn't immediately turn people off. And that's part of I think the best part about working at SRA is we found this way to make taxes for lack of a better word, sexy. We found this way to talk about taxes and make you care, to talk to legislators and not have them just immediately shove it out of the room. And we do this by supporting our states and talking to them about what they think they need and what their experience has been, because at the end of the day, we don't know your state better than you do. And that is one of the best parts about being a part of this national organization, is that it's not coming in and telling state advocates how to advocate at their state house. It's actually listening to you and giving you the tools that support you and what you're doing. And next slide. Caring about babies means caring about taxes. And if we were in person, I would give you these amazing buttons that we co-created with CFP. Maybe I'll find a way to get them to everybody. Maybe we'll meet in person one day. Because at the end of the day, when you center children and families, you show just how powerful and positive tax policy can be, and how it's something that everybody should care about more than just your personal income tax. It's about corporations paying their fair share. It's about the wealthy actually paying their fair share. I've seen a lot of stuff on tax day about how many corporations did not pay their income, but I paid a lot of income taxes this year, and definitely should not have paid more than Walt Disney did. So I'd love to take the time to pass it over to Amber so she can talk a little bit more about how tax campaigns look like on the state side, as well as how the federal bill is affecting taxes.
Amazing. Thank you so much, Jamie. And just to build on what Jamie says, and Andrea, you can go ahead and go on to the next slide. Uh, as Jamie said, we think it's a really important time to be having these conversations about that connection between taxes and revenues and early childhood and PN-3 programs right now, because we are in an unprecedented time when it comes to not just the really pressing needs of kids and families and this history of underfunding of those essential programs that they need most, but also some very bad federal cuts that are impacting kids. And because those factors are intersecting with a growing movement that we're all a part of right now, to center kids in public policy in different ways, and certainly in tax and revenue work. And you can see on the next slide, where I'm going to start is kind of what we're up against. So, and this is kind of appropriate on tax day, and maybe those feelings that it stirred up amongst folks. But as Jamie mentioned, tax policy for decades has really favored the wealthy and the well-connected, and that our tax codes at both the state and the federal level have become so skewed that so many of our communities have been disproportionately denied access to opportunities. All of this isn't by accident. Instead, it's because for many decades, you can see some of that stuff here, anti-tax stakeholders have really deliberately attempted to shape attitudes, discourse, elections, narratives, public policy to meet their interests, which are cutting taxes for the wealthy, for big corporations. And so many decades ago, our opposition on these issues really dove in and doubled down on their support of anti-tax work in an unwavering way to ensure that anti-tax efforts were really well resourced, well coordinated, and to do that in order to shape public policy to meet their interests. And so while anti-tax stakeholders can sometimes be those ones that are happiest to stoke fires of culture war and division, behind closed doors, or as we saw in the front row of the inauguration, or you can see Arthur Laffer in the bottom right up there, they have long known that winning on tax is their most important source of bread and butter, and they've acted accordingly. And so that's kind of what we're up against. On the next slide, you can see that, of course, I think we all know here, you all have heard on NCIT calls before and SRA calls, that the recently passed federal tax and budget plan last year will make all these things worse, because that enormously expensive federal tax bill that included over $4 trillion in tax cuts that overwhelmingly benefit rich Americans, that's being paid for partly through measures that really harm our families and our kids and cloud their futures, including millions losing access to health care and food support, increased health insurance costs, education and early childhood cuts, and major holes in state budgets due to funding cuts and cost shifting measures that really put every state in precarious financial positions. And you can see on the next slide there, this is a Minnesota specific example because we were recently with our partners in Minnesota, but the benefits of those tax cuts will be felt mostly by just the top 5% of earners, but the cuts that were made to pay for them will be felt by the vast majority of kids and families across the country, including, and this is just in Minnesota, nearly 200,000 people losing access to healthcare, over 200,000 seeing decreased or eliminated food assistance, SNAP benefits, increased health insurance premiums, hospital closures, increased energy costs. And this is really important for all of us here on the call today, a major hole in this case, Minnesota state budget due to program cuts and cost shifting measures. And on the next slide, you can see that something to keep in mind is that those federal cuts and cost shifting measures will have major repercussions in every other issue area as well, whether the funding comes from federal or state sources, because as we think about the scale of the cuts and cost shifting from the feds onto the states, we see that the holes that they will leave in budgets dwarf even just the state spending on many areas of interest. And so you can see here, cuts are expected in Minnesota from the federal bill to total about $2.5 billion per year, and compare that to what the state spends on early childhood programs and services, which is around $90 million. So the size of that budget hole is 30 times what the state spends on early childhood programs. On the next slide, you can see, so while there's been major PN-3 progress, funding progress in recent years, we know, of course, as child advocates, we all know that enormous needs remain, right? As many of us have seen over the years, programs that serve babies and families and those most in need are too often the first ones, the ones that are most at risk when states face fiscal hardship. And so federal cuts, state fiscal constraints threaten not just future prenatal to 3 program progress, but also even just maintenance of the status quo and current program budgets. You can see on the next slide, and Jamie touched on this, but these federal changes loom so large because on average, about a third of a typical state budget comes from federal funding. And so states have to balance their budget, even when they're facing major pressures, which we know are exacerbated by things like inflation, recession, ongoing affordability crises. And so a major trend that we're seeing this year in state taxes is really that states are facing budget shortfalls. Many are, and absolutely all will shoulder and are shouldering more responsibility for key early childhood programs at the same time that our communities are facing critical needs. On the next slide, that's kind of the bad news things, of course, but I also really want to stress that there's good news too, and that there is reason to hope and to believe and evidence to point to that we do have the bright future, that we have the tools, the foundation, and the strengths that we need to build it for our babies and our kids and our families. And a key part of that optimism is why we're all here, right? It's that we know the taxes have this really unique and powerful place in the policy realm to advance child well-being, because taxes determine whether or not those programs and services that matter so much to families, the childcare, the prenatal and maternal health programs, childcare and home visiting programs, paid sick and paid medical leave, guaranteed basic income, child tax credit programs, taxes determine whether or not those programs have the funding needed to provide critical support and opportunities that generations of across the family need to thrive. And we know that if we're not right-sizing our tax systems and raising revenue through taxes, then we could be designing great wage and career ladders that can't be funded. We could be making a really compelling case for increased childcare eligibility that then can't be supported because our state lawmakers will say, well, sorry, we love kids, but we just don't have the money right now. The other piece of good news that I'd say is that, at SRA, we're really lucky to be working with state partners all across the country. They recognize tax for that incredible power that it has. And so point as we think about like the long-term history of child well-being movement and the tax movement is that each month, ever increasing amounts and numbers of groups and diversity of groups are organizing communities around these issues all across the country. I mean, you can see there, these are our partners that work in New Hampshire, Connecticut, Pennsylvania, Arizona. Up on top, we had a organizing training on taxes that we did in Boston for 300 folks across 30 states. People are hungry to engage more in a way that meets them where they are and what their members need, that aligns with their priorities. And, another bright spot, you can see it here on the next slide. And go ahead, I think mine might have frozen, Andrea. Just go ahead and advance. Yeah, there's our communities. And then on the next slide, we've seen the number of groups increase over that same time period, we've also seen a significant increase in the number of progressive tax revenue raising bills being introduced by an ever increasing number of sponsors, and including, you can see there in 2023, 11 pieces of tax justice legislation that we are supporting state partners on, and that's nearly doubled each year along with those legislative sponsors. And so that movement, that political will to pass this legislation, to pass revenue and invest it in programs for kids and families, that continues to grow. You can see on the next slide, that movement progress is really resulting in billions of new state revenues approved in 2025 and already in 2026 that will significantly improve tax justice and revenues available for essential early childhood programs in states across the country, including significant progressive revenue in states like those, Maryland, Washington, who in past years increased taxes on capital gains, just passed a millionaire's tax. Illinois is considering a millionaire's tax. Last year, passed tax on multinational businesses. Maine just passed a millionaire's tax. New Mexico, we increased revenues from oil and gas. Numerous other states that you can see there. And on the next slide, I just list some of those, and there's a lot of stuff happening, but one thing that we really want to lift up is we think it's really important to consider and to compare those tax and revenue wins, the revenue that they won for essential services, with how much was invested by groups like SRA, by groups like those on the call, by our philanthropic and funder partner support and funding that it took to make them happen. And so this is just a sampling of what some different pushes that SRA staffers led or played a strong role in, and what they cost states and what they returned. So you can see there, of course, New Mexico, that's close to my heart because that's where I was. But if we think about the scale of the investment versus the revenue return, Massachusetts, it's huge, and I'll talk a little bit more about that. New Jersey, Washington. We lift these up because we know that revenue leads to big returns on investment in a really tangible way in funding for things that benefit kids and families all across the country, and in ways that benefit our youngest family members and learners, even when those funding programs aren't necessarily dedicated funding sources. They enable progress through early childhood programs directly sometimes, as you'll hear more about from Bruno on some of those dedicated funding streams, but also in indirect ways, either through increased general fund funding or to other programs linked to improved early childhood outcomes, things like food security, K-12 investment, transit, so parents can work. All of these things, just great examples of the ways that revenue can build opportunities for kids and families. And on the next slide, you can see, including in New Mexico, our ballot campaign in New Mexico that we kicked off early in 2011 and passed in 2022. As Lori said, that gets a lot of attention, and that passing that ballot to change our constitution, so the Constitution guaranteed funding for early childhood programs and services, while that is one of those things that, that's like something I want on my tombstone and I'm so immensely proud of, and it benefits my family, my community, all across the state, and I just love that work. But what made it possible was not just that one campaign. It was not just that one funding source, because we raised revenue in New Mexico from a number of different sources that really did empower this incredible progress of making childcare free for all residents and families. And I lift that up because while all states have different revenue opportunities that may look very different in different states, revenue is possible for every state. And on the next slide, I'll show you a little bit. This is a lot of information, but I mainly wanted it available to folks if they wanted to. But what I'll draw your attention here, because we're at SRA always available to talk about what kind of inclusive campaigns can look like, whether they're legislative or ballot or primarily public and policymaker education. There's different ways that can look. But what I want to point out is what that looks like when it's investing with kids across the board. So in New Mexico, we passed a lot of tax credits that were targeted to kids. But I think the biggest thing is at the same time, we're increasing fair and equitable revenue We did that through a number of different measures. And what that enabled is the real win for New Mexico kids and families. All of those revenue streams enabled universal childcare, universal school meals, increased K-12 funding, free community college tuition, expanded Medicaid coverage for women and babies right after birth. We decreased child poverty in New Mexico by more than a third. That was largely due just to those tax changes itself. So that's all to say that raising revenue is such that a powerful tool to give us what we need to invest in kids. And on the next slide, this is a slide we have on Massachusetts. A lot of the team at State Revenue Alliance were the leaders of Massachusetts's Fair Share campaign this past in 2022 also. But again, you know, I'd say in New Mexico, I love and I'm so proud that we get all this attention on universal childcare. So much to be proud of for sure. And also, Massachusetts isn't getting quite that same attention because I don't know that it's as clear to folks what Massachusetts has done. So in 2022, raised taxes on millionaires in Massachusetts, big ballot campaign. But what I'll draw your attention to is down there on campaign outcomes, the fourth bullet, expanded childcare funding. What the Massachusetts Fair Share campaign is paying for in Massachusetts is $1 billion more every single year that is being invested in childcare in Massachusetts. So again, you'll get to hear from Bruno here in just a minute about some incredible work to increase direct and dedicated funding streams for early childhood. But oftentimes, as we're protecting revenues and raising revenue, bigger picture, that is what will enable some of the biggest investments, like in Massachusetts, $1 billion a year more for childcare. And last, just to wrap up on the next slide, you know, all of that alignment and that big picture thinking we think is important because, you know, we also know the context and with the decision in which the decisions are being made this year. It's a big electoral season with major ramifications. There are, of course, congressional midterms. 36 governors are being elected. 88 out of 99 state legislative chambers will be up for election across 46 states. And significant revenue measures are being considered by all states right now on many ballots. And so we think on the next slide, you can see, though it's a very tough time for our kids and our families, opportunities to center kids in taxes and budgets and funding are more available and within reach than ever before, which is a good thing because we've never needed that revenue to support critical programs for our babies and families as we do now. And we think centering kids and how states respond in this moment of challenge will be the way that we protect our families and really create a brighter future for all of our kids and communities now and for generations to come. And which that just, you know, next slide, we're so happy to answer questions or take requests from folks. Don't hesitate to reach out. And I'm so proud to turn it over now to an awesome colleague and friend of ours who I've known and admired for many years, Bruno at Children's Funding Project.
Awesome. Thanks for that, Amber. I was going to say, man, tough act to follow. I need to start volunteering to go first on these things, I think. But no, I really appreciate everyone for being here today and giving me an opportunity to talk to you. You know, Amber and Jamie, everyone at SRA always does such a great job of grounding us in why, you know, if you care about kids, you need to care about tax and revenue policy. I'm just going to talk to you about some ways that states have dedicated funding for early care and education, which is just one tool in your toolbox as an advocate. But hopefully these examples will show that it can be like a potent tool in your toolbox that can really show the kind of impact you can have for children and families when you're willing to take on tax and budget policy. Next slide, please. So, you know, I won't belabor this too much, but just some examples. We've talked about these. Amber mentioned New Mexico in her presentation, which I think most of us have probably heard about quite a bit at this point. Another state that's recently made some strides that I think have gotten national kind of press is Vermont. A couple of years after New Mexico, a couple of years ago now, also made some major investments at the state level, raising a payroll tax in order to fund early care and education. But you know, it came to mind as we were following these national stories, kind of like Amber said, that, you know, New Mexico's getting a lot of attention. Other states have done things and aren't getting as much attention. You know, we decided to kind of do some investigation into that, which is why, next slide, please. We created this policy brief that details how different states have dedicated funding to programs for children and youth. To be honest, it's not all specifically early care and education, although a lot of it is. Next slide, please. And so before we kind of dig into the examples, go more into that policy brief, the findings, go through some state examples and show what they've done for early care in their states, it probably makes sense to ground ourselves in what I'm talking about. So as Amber mentioned, like today we're talking about states, right? States need to step up as the feds are kind of stepping back in these areas. Localities, which I believe SRA and CFP both work with, can do something to fill the gap, but states have way more resources available to them than like cities and counties do. Also much more responsive to the public than like the federal government. So that's why we're focusing on states today. Talking about funding that's dedicated for the specific purpose of early childhood programs, meaning that it's outside of the typical budget, general budget, not part of the general appropriation fights. We think that kind of adds an additional layer of protection for these programs to kind of ensure that the funding is sustainable and continues through the future. And obviously, as my friends at SRA did such a good job of expressing, if you're not talking about taxes, it's just going to be pretty impossible to raise the amount of revenue that we need to move the needle here. Next slide. And so, as I mentioned, you can see here that states like Vermont and New Mexico do not stand alone. In fact, and this is from the publication, which I think we can share a link to that in the chat if folks are interested. But we've identified about 20 different states with about 25 different funds. Some states have more than one dedicated fund for children and youth. The oldest of these goes back more than 40 years. But you can see that there's been increasing interest over the last decade or so. More and more states have become interested in this policy. And in fact, since Louisiana did something in 2017, at least one dedicated fund has passed every single year since then. And at least one of those funds has been dedicated to early care and education. In fact, Washington just this year, I think a great example. I think I feel great about that because now I can say, check 2026 off the list of another year where we've done something to dedicate state revenue to programs for children and youth. And also, as you can see there, New Mexico has a particular revenue stream available to them. But there's a lot of different ways that you can attack this issue. And you see there that different states, depending on their political context, have relied on different revenue streams to dedicate to these issues. Next slide, please. Just another way of showing that. Actually, you can kind of cross the continental United States without ever leaving a state that hasn't, dedicated something for children and youth. That's kind of cool. Useless statistic, but I just thought it was useful to show, a significant part of the country, a lot of states here. Next, please. And so I think it just makes some sense, it makes sense to take some time to walk through a few particular state examples that have happened recently, explain what they did for children and youth, and a little bit about what it took for them to get there. As I mentioned, the publication that we shared, the policy brief I put together, does go into more background about these things, but just wanted to give a kind of high-level sampling for the purposes of our conversation today. Next slide. So won't belabor this. Amber's here. I saw Jacob in the chat also. Plenty of people here who know as much or more about this story than I do. I did want to note that number here, I said 250 million. I think that was the amount that was dedicated to ECE last year. That amount has increased this year. I mean, it increases every year, but I believe New Mexico made a policy choice to increase that by quite a bit over last year's total. Which is a theme that you will see across some of these examples. And I think kind of points to why we think that dedicated funds are such a compelling example. It's a lot more common for them to get more sources of revenue or increased funding than it is for them to kind of get clawed back or taken away. So it's a more one-sided kind of advocacy space after that. Next slide, please. And just re-emphasizing something that Amber said, I think now is an important time. The rubber is hitting the road in terms of the budget cuts that have happened at the federal level, the impacts that those are going to have on children and families and on state budgets. But also to just a note of caution that these things take time, right? Like it's not an overnight process. This is also something that you'll notice through these different exampled funds is that, it usually takes time and multiple bites at the apple before you succeed. But that means, if not you, who? If not now, when? Next slide, please. Louisiana, I mentioned a little bit earlier. This is one that we're kind of excited about because we think that they kind of helped reinvigorate interest in this idea of dedicated funding in modern times. As I mentioned, the oldest one we could identify went back to 1984, but more than half of the funds that we saw have been implemented in the last decade. And so like this was a turning point in the state policy landscape, in our opinion. And interesting to note that it was initially created without a dedicated source of revenue. So they created an empty vessel, like a container. And then once that was there, they had to keep going back, in subsequent legislative sessions to get revenue, to essentially hold policymakers accountable to this, the fund that they created and promised to find revenue for. And advocates in Louisiana succeeded at that. You can see here that it has like 5 or 6 different sources of dedicated revenue actually today. Although next slide, please. I mean, candidly, most of that revenue is sports betting revenue, right? But a couple of notes about that. So one, just maybe not in the same realm as like $1 billion as we saw in Massachusetts, right? But they went from not raising any revenue for this purpose at the state level or dedicating any revenue at the state level to that, to dedicating tens of millions. Right, and they started without any dedicated source of revenue and found a way to get revenue to the program. And another thing to note is, because a portion of sports betting revenue is dedicated to this fund, every time they increase the amount of like the rate of taxation on sports betting, more revenue goes to this fund without any intentional mechanism of, they don't have to go back and say, let's dedicate a new source of revenue because they've already dedicated it. When there's a policy change that increases that, more money goes to programs for children and youth as well. So just another example of why we think that these dedicated funding sources, these dedicated funds are really a useful example for advocates to think about, particularly in these times of like fiscal stress and like budget pressure. Next, please. Vermont, just another example of a state that found a lot of revenue for children and youth. I won't belabor this too much, except to say that it's another example of a state that, in order to get this done, they had to take legislative action in previous legislative sessions to do some like formal cost modeling to figure out how much the state needed to spend on early care and education to address the issues that they were having. They did that successfully, and then they used those findings in subsequent legislative sessions, ultimately to work with the business community, other advocates, local officials, state policymakers, obviously, to get consensus on what the appropriate mechanism to raise the amount of revenue needed was. And so it was like a real collective effort to get buy-in on the payroll tax. Next slide, please. Just another example that happened just last year that Connecticut got some dedicated revenue for early care. It tried to do some of the things that New Mexico did in terms of like ultimately the goal of trying to make it free for certain families, capping the amount out-of-pocket expenses for other families. There are also provisions in there to increase educator pay. This was a pretty significant amount of revenue at $300 million. Of course, I think, again, noting here that it was surplus revenue, meaning that as the budget situation has changed at the federal level and with the implications on state budgets, just another way of saying that, you can see here with this timeline, it took advocates several years to get the buy-in they needed to get this win. Even once you get the fund, the fight's not over, right? Like you've made great progress, but you need to keep on it to ensure that program integrity, adequate revenue. But just to say, like, good to get to notch the win and then continue working on it. And next slide, please. Actually, pretty much the same story in Montana, right? Again, a different political context, a different state. $10 million is not $300 million. All that said, $10 million is better than zero, which is what they were doing before. And also, again, that this is something that is, sustainable in the sense that although it's technically targeting surplus revenue, there are some particular, mechanisms of essentially corporate income taxes that can be dedicated to this if revenue isn't adequate to meet the need that year. So there is some fallback mechanisms in this one. Hopefully those are some useful examples. Next slide, please. And I think it's useful for us to talk about what CFP can do if it sounds like this is something you might want to do in your state. Next slide, please. So Children's Funding Project, we do something we call strategic public financing, which essentially is 3 separate questions. One is, where's the money coming from? And we can help you answer that with fiscal mapping. So essentially, we offer a service where we will help you determine where the money for programs for children and youth is coming from in your state, and then where's it going to in your state, in the simplest terms I can explain. Next slide, please. The next thing to know after you know where's the money coming from and where's it going to is how much more do you need to spend to get to where you want to go. And so we address this with something we call cost modeling. Essentially, based on the metrics that you care about, is it out-of-pocket expenses based at one income? Is it educator pay, some combination of affordability and accessibility? Just working with you to determine what it's important for your state to be able to fund to move the needle for children in your state. And then we'll help you figure out, now we know how much money you're spending, where it's coming from, how much more would you need to spend to get where you want to go. Next slide, please. And then my job here is, once we have that idea of how much you need to spend, how much to get where you want to go, I can help you figure out where exactly that money is going to come from in your state, being pretty comprehensive in the things that I look at. And also, next slide, please. Also walking you all through or working with you to determine, what it is about those revenue mechanisms that matter to you, right? Is it the regressivity? Is it the adequacy? Is it the how feasible it is to implement, the stability of the revenue stream? A lot of times there's trade-offs between these issues. And, me and my team at CFP, happy to work with you to figure out, what makes sense for your group, your coalition, the advocacy space, political context in your state. And I think I'm passing it back to NCIT. Oof, I should have practiced this better. But that was it for me. I'll appreciate it.
All right. Thank you so much. So that was a lot of information. So while we're pivoting over to the Q&A section for everyone, I'm going to launch a quick poll. So while you're thinking about your questions, you can raise your hand, you can drop them in the chat, come off mute, however you want to do it. But there was one question that I believe I already got answered, but Carl, please let me know. They would like to know where you can find the data on what the state of Texas is doing on this issue. All right. Any questions? Any comments? Any disagreements that you want to bring up? Yes, Wendy.
Hi, I'm sorry, I'm eating lunch at the same time. This is such a wonderful, I just love all the information. And Bruno, I'm just curious to pick your brain and your team's brain about, we're seeing kind of an increase of maternal infantile homelessness issue. And so I'm just curious about, obviously there's not really carve out for infant and toddler homelessness. And is there potential that we could pick your brain in your team to figure out what California funding state allocated for housing, and if we could pivot to kind of put this population at the forefront? So just a thought.
Yeah, happy to have that conversation in more depth. I know we're working in California in some capacity, so could make some connections there. At the high level, to answer or respond to that, though, I think one thing I didn't mention in talking about dedicated funds that might be useful to talk about in this context. And Amber, you can jump in too. I know, for example, like in New Mexico, not all of the additional revenue went to early care and education, right? A certain share went to K-12 education as well. I haven't seen an example of it passing, but I've seen a couple of states try to do something similar. So a portion of the fund goes to early care and education, a portion of it goes to housing or homelessness assistance services. Maybe there's something along those lines that could be, take some more ideating and brainstorming, but I can see it seems feasible to kind of tie those things together in a way that makes sense politically and like policy wise.
Yeah, and I think that's right, Bruno, and I'd add to you, Wendy, that's true. In New Mexico, 40% of the ballot amendment funding went to K-12, and then New Mexico also had created, we did it in 2020, a separate fund specifically for early childhood services and programs, but that's a broad definition. And so that also can go to other prenatal to 3 programs, including prenatal and maternal health programs. And that's similar to what when Connecticut, I was involved in that, and Jacob V. Hill, who's also on the call in New Mexico, involved in supporting like modeling that. And so states do have lots of options, whether it's dedicated funding or creating funding and capturing some kind of excess revenue to put into it. So lots of different ways you could design that. And yeah, we do to Lori, a question I see, Lori, your question in the chat about state tax organizations. We have those if anybody's interested, and who in your state is working on taxes and what are they doing. We have all of that, and we work with groups all across the country. Many policy groups, many grassroots groups, many labor organizations are doing this work, and so happy to share that.
Great, thank you. So we do have some questions in the chat, so I'm just going to go down in order. This is for CFP. Does CFP do estimates of what funding is needed to build the supply to meet the need? If so, how do you usually approach that? And also, if a state wanted to figure out the cost of fully funding childcare, but wanted to ensure that the cost includes fair pay and benefits to providers, how would you include that in your estimate?
So just want to be fully transparent here. I don't know anything about how the cost modeling actually works. I do the revenue side of things. So happy to connect you with Kate, who runs the cost modeling team here offline, but I just really don't want to say something incorrect based on my own ignorance. I think high level, we can address those issues. We would need to work with you to figure out what the metrics look like in your state, but I think we could do something.
Awesome, thank you. I do see Jacob did also respond to that, Julia. So Jacob, if you want to go ahead and drop in your email in that so Julia can reach out to you, that would be amazing. Next, Amber, do you have examples of sources or provide support for states looking to raise campaign funds?
Yeah, we sure do. A lot of our team are just campaigners and organizers by training and by practice. And so that's kind of one of our sweet spots, is about how you effectively run a campaign that centers just economic justice, tax justice, kids in revenue raising. And so happy to reach out. And we can, on our team, we can also drop in, we have a link of supports that we can provide to state partners, parts, some that are tailored directly to early childhood and prenatal to 3 organizations, others that are economic justice and pursuing other issues. So we can drop those in. But yeah, definitely happy to chat offline. And that's definitely one of the things that we can provide to partners.
Great, thank you. Jamie did drop that link in the chat. And again, all these links for resources will be provided in the follow-up email. A question from Sydney, California housing, is it in your country BHSA plan? And if no one knows what that's referring to, Sydney, if you'd like to come off mute and kind of elaborate on that question. And by country, I meant county, excuse me.
Yeah, there's a funding source, Proposition 1, that provided behavioral health funding. And the question is whether the particular housing group that was mentioned in San Bernardino, and it's certainly a problem in many other counties, is included in the plan. The plan's an opportunity to raise that issue, and if it's not in the first year, to revise it in subsequent years. but that's a group that tends to get left out of the housing discussion in California. So it's a great need.
If you don't mind, I wanted just to answer that really quick, Christine, because we called out San Bernardino really quick. So what's interesting about Prop 1 in California is that it's used to be the Millionaire Tax Bill, MHS, and then now they call it the Behavioral Health Services Act, which they carve out significantly for county behavioral health to do housing and all that. But what's left out is the prevention and early intervention. So I just got back from the Capitol to do an advocacy to push for really including 0 to 5 population into the allocation so that the state funding could provide a push to kind of solely for the 0 to 5 population, whether it's housing, whether it's other mental health services needs or anything like that. So hopefully, Sydney, we should definitely connect and then work together on the housing need in California.
So thank you. Another question in the chat. Do y'all have any recommendations for pro-text messaging that have worked?
Pro tax messaging probably, and yeah, we definitely can. We can include those in follow-up resources, and at State Revenue Alliance we do a monthly meeting almost every month, unless we're doing a big event that month. We do a monthly meeting focused on different aspect of tax. Any folks on this call, any of your aligned partners, welcome to join. You just go to our website and join. But our February monthly meeting focused on messaging around tax issues, particularly in this climate. And so one of the things we can send Lori and Andrea as a follow-up is a recording of that. And then, a couple other resources that we have.
Great, thank you. Another question is, one issue we're experiencing is more progressive legislators being opposed to using public funds to support private child care programs. As we talked about raising revenue, has anyone successfully worked through this?
I can start and then Bruno, please add. But yes, it's a issue that comes up across many states. And depending on the political climate and your own constitutional requirements, like in New Mexico, that was a big part of our fight to even get what became the ballot amendment, to get it out of the legislature and onto the ballot, was the pushback from private childcare providers who now actually are able to receive some of that funding, but they opposed the measure for a very long time because they felt like they wouldn't get the funding. And so that's all to say the fight can go different ways in different states, where states either decide to figure out a way where that can go to private providers, particularly in-home providers who might be receiving support or public funding, and some other states figure that that's not the right way for them. So yes, I think there's fights that we can point to. I don't know if Bruno, if you would add anything on that point.
I'd follow your lead on that, Amber. I haven't actually seen that come up personally. I've heard of it, but in the states that I've worked in, just the political context that they're in, it's really just been more like, can we raise any money at all, right? Like I think somebody in the chat said, I don't think we're going to do this in Tennessee. So I think that's like honestly more of the kind of challenge that I've seen in the work that I've done in this space. But yeah, like I said, I know that you guys have worked on this too. So.
All right, thank you. I do want to point out in the chat, there's a lot of connections being made. So if you had commented or somebody commented on you, it looks like a lot of folks want to connect with each other. Make sure to grab their email address. Any other questions for this group? Otherwise, we have about 5 minutes, so about one more question that you want to bring up. Any comments? You can raise your hand, drop them in the chat, just come off mute. All right. Well, on that note, I want to thank our presenters so much. Question, Julia, yes. Oh, okay. Excuse me. Any lessons learned from other states that created dedicated funds for childcare? What have the pain points post-implementation? Any issues with policy makers saying you have enough with your dedicated funds, so stop asking for more?
Yeah, so I get that question a lot, actually, which I get, but Typically, the answer is no. And honestly, I think that's because the advocates that we work with do a good job of being transparent about what they're really asking for. Like in Louisiana, they weren't saying, please give us 10 billion or $10 million of sports betting revenue. That wasn't the ask. That's what they accepted, right? That was what they could win in the legislature. But their actual ask is, we need probably billions, hundreds of millions of dollars for childcare, and that ask only changes as the costs themselves change, right? Like even if that's not the kind of narrow legislative when you're going for this legislative session or whatever, being able to have the relationship with legislators, policymakers, other advocates about like what you're pushing this ball towards. I think that's important in preventing that from happening. So I get where that question is coming from, but I think that you can be smart in your advocacy and avoid that kind of reaction personally.
And I'd say, and I agree with Jacob, my former and forever colleague in this work. I agree with some of what you're saying, Bruno, and I'd say I've definitely felt it. We felt it in New Mexico, almost immediately. It's like, whoa, aren't kids getting enough though? And there was a legislative finance committee report that was basically like, kids get this, then they get this, now they get these tax credits. Now everybody's getting childcare. And there's a pushback from an evidence like, but we're not seeing increased reading scores yet, or eighth grade math scores have not, So I think that we're also seeing in Massachusetts where it's like, okay, we raised taxes. Now we're getting $6 billion. That's how much the fair share taxes brought in. But now there's immediate attempts to repeal it. So it's like we've got these decade-long journeys to pass dedicated funding for early childhood, and then we have to spend a decade defending it. And so I think it also points to how we make the case initially. Like there's an implementation aspect of it, and certainly having a dedicated agency within a state that holds all these, that can pull all the various programs, whether they're health programs or early intervention or childcare or pre-K, they can pull them all in, they can pull all the funding sources. That's key for implementation. But I think just as important is building diverse, inclusive movements that are pushing for these. And so when we get that pushback, we don't revert into that, like, how are we protecting our piece of the pie? Which a colleague of ours on our team at SRA came up with a new analogy, not just like fighting over shrinking pieces of the pie, but rearranging the deck chairs on the Titanic while it sinks. It's part of why, like, we all have to be in this across issues, willing to go to bat for kids across all the issues that touch them. And that way we can better defend when there's that pushback from legislators. Like, isn't this enough? To your point, Bruno, they don't have nearly enough, but isn't this enough? Why don't we give it 10 years and see if reading scores increase? And we think about how we make that case, about the diverse ways that all these things can benefit kids and families for generations, not just those specific programs.
Thank you so much. With that, I know being mindful of time, I want to thank our presenters so much for their time today. Thank you everyone for joining the call.